We know that Alberta's Auditor General has launched an investigation into the province's health spending. It includes looking at chartered surgical facilities, or CSF, and allegations around contracting and potential conflict of interest. But let's take a step back and focus on how those facilities fit within the province's healthcare system. So they're privately owned, but the companies sign contracts to get public money to take on a variety of surgeries for AHS.
So rather than having the surgery done in a hospital, these are exclusively day surgery procedures. So they're high volume procedures that can be done safely in a community-based setting rather than in an acute care hospital. So we have rapid turnover, high volume. Cataracts, hips, and knees are by far the most common.
In 2021, the province was dealing with a surgery backlog. As a solution, it announced partnering up with CSFs. Currently, AHS has close to 50 active contracts. So let's take a look at the pros and cons.
The pros are they can help reduce wait times. They allow the system to be more flexible, that it can, in effect, offload some of the costs of this to the operator of the facility. They would reduce wait times if they weren't using doctors who would otherwise be operating in the public system.
This chart shows a rise in the percentage of surgeries done by CSFs over the past 4 years, with the peak being around the time the province paused surgeries under AHS. But since then, there's been a gradual rise. Some of the criticism is around using private businesses for public health care, and these facilities aren't required to share details of their contracts.
This is a public healthcare system to be managed for the public good. We can't know that if we can't see where the money goes.
If I'm operating a private surgical facility and I'm responsible to generating a profit for my investors, I want the best price possible. So how am I going to make money? Now, the argument is, well, they're more efficient. Well, we don't know if they're more efficient.
Under Premier Danielle Smith, the government hasn't announced any current targets for surgeries, but there has been an increase in CSFs taking on the province's surgeries since she's been leading the government. Travis McEwan, CBC News, Edmonton.